Hi, everyone. It's Dr. Purcell. Welcome to Facebook Live. Today, I am talking about boosting fertility. And in this Facebook Live, you are going to learn the 5 things every woman can do to boost her own fertility. You know, when I was writing this Facebook Live, it occurred to me that I really have 2 subsets of patients. I have a whole group of women around the age of 35, I call them the over 35s, who are wanting to become mothers later in life and dealing with some of the challenges and what it means to become a mom over the age of 35. And then I have this other subset of women who are over the age of 45 who are dealing with perimenopause and menopausal problems. So I really do understand the whole gamut of motherhood and then the transition into perimenopause and menopause and all of the struggles that many of you are having. So today we're going to talk about boosting fertility. And, we know the science behind fertility, but a woman's fertility is still this really awe-inspiring thing that happens in this magical inner world. And you can just really connect with this if you know of a woman who just found out that she's pregnant, or if you remember the first time that you ever got pregnant and how incredible that feeling was. It literally takes your breath away. So statistically, fertility rates have been dropping. And fertility changes by age bracket. So if you're under 35, generally you are considered to be more fertile and have less complications with pregnancy. And if you are over 35, you're considered to be less fertile and be viewed more as a high risk person or patient, and you are generally classified as being advanced maternal age if you're over 35, aka old, which is not really very flattering. But the definition of infertility, if you're under 35, this definition also changes. So if you're under 35, definition of infertility is having unprotected sex for 1 year and not conceiving. If you're over 35, the definition of infertility is having unprotected sex for 6 months and not conceiving. So those numbers also change with age bracket. So many women are postponing pregnancy until later in life because of careers and education and independence and a whole multitude of reasons, not finding the right partner, being too busy to find the right partner. And in fact, now 20% of all of live births in the United States are occurring to women at 35 or older. So some pretty interesting statistics there. But no matter how old you are, if you plan on becoming pregnant, the tips that I'm going to share with you today are extremely valuable to any woman who's wanting to increase her fertility. And I really want to encourage you to take charge of your own fertility, right? Because it's your body. You have a lot of control. You have more control maybe than you were led to believe, on a lot of levels, but certainly on this topic. And so these 5 tips, be sure to keep them in mind, maybe if you're going to be planning for your upcoming family. But in essence, it takes 120 days for a healthy egg to form. That's 4 months. 4 months. So if you plan on trying to conceive, you want to start implementing these tips ahead of time to have your body have the best chance at implementation and fertilization of an egg, right? So again, you want to start doing some things proactively before you even start trying to get pregnant. And this is some stuff that kind of misses the boat. A lot of people don't talk about. It's really important. So my tip number 1 is about birth control. Oh, birth control. I could talk about birth control for a long, long time. But in essence, birth control should only be used for birth control. Okay? So if you're on it for any other reason, if you're on birth control to take care of your cramps, to help with an underlying hormonal issue, to deal with acne, that's not the right reason to be on birth control, because there is an underlying hormonal problem at hand. There's a real issue there that birth control is just kind of putting the lid on. So I want to have you take a moment and think about this. If you're on birth control right now, why did you initially go on birth control? Was it for cramps? Was it for acne? Was it to regulate your cycles? Was it because you have PCOS and you had ovarian cysts? So you kind of see where I'm going with this. We have to look at the why. Why are you on birth control? And if the hormonal issue is not being fixed, because birth control is not fixing the issue, and you plan on getting pregnant, then it might be time to jumpstart your hormonal health or your endocrine health and get those hormonal rhythms cycling the way that they're supposed to. Because birth control doesn't jumpstart your hormonal rhythm. It actually does the complete opposite. It shuts it down. It shuts your ovaries down. And the conventional medical system doesn't really address the long-term detrimental effects that birth control can have on your reproductive health. And we just seem to think like, oh, we could turn it on, we could turn it off, like it's a light switch, like turn on my ovaries, turn off my ovaries. But it doesn't happen that way. Nothing in the body happens that quickly. You know, if you've ever tried to lose weight, right, and you go on a diet and the next day you go on the scale and you expect the scale to be down a pound, like things don't happen that quickly. So we kind of have to have a deeper understanding of how your body is working and what it's doing. But in essence, birth control shuts down your ovaries. It puts them on vacation. And in order for you to ovulate, you need your ovaries functioning and working. And depending on the type of birth control that you're currently taking, it could take anywhere from 1 to 12 months in order to re-regulate your cycles, right? For your body to reboot. And many women are surprised by this. They don't realize the amount of time, or they don't take that time into consideration when they're family planning. But it makes perfect sense. So let's look at it this way. If you have been on birth control for 20 years and now you're 37 and you met your soulmate and your life partner and you want to start a family, right? And you're just like, okay, I'm going to go off birth control and then it's going to happen. Your body has been redirecting essential energy away from your reproductive system for 20 years. You've been sending the message to your body, shut this down, shut this down, shut this down. So what do your ovaries do after 20 years of being told to shut down? They shut down, right? Again, many women are surprised by this, but this is a really important conversation for us to be having. And especially if you have been on birth control for 20 years because of an underlying hormonal issue, right? How long is it going to take to address that hormonal issue that you've been blunting or suppressing or turning off or just blocking all of this time? I mean, these are things to consider because women over 35, you know, if you decide you want a family plan and you meet the right person, everything in your life is aligned, I mean, the clock is ticking. So these are things to think about. So it can be very helpful to work with an alternative practitioner or a naturopathic doctor to help you get underneath your issues and really correct this underlying imbalance and then get you as healthy as you possibly can be so your ovaries can just jumpstart and start working and you can start ovulating and then you can really start family planning. But in my practice, I regularly work with women to help balance their hormones, you know, and I say when we're doing hormone balancing, this is going to make you more fertile. You know, and some women are here because they want to enhance their fertility and they plan on getting pregnant, but other women, you know, are in my office just because they feel terrible and they have all these hormonal imbalances. And it's just really important to know, like, as you get healthier, you will become more fertile. And that's a good thing. That's what Mother Nature intended, right? So, birth control. Yes, that is a big one. It's a very big one. So that's tip 1 is birth control. Just kind of look at if you are on birth control, what are you using it for, and is it there suppressing something else? Tip number 2 for you today is to stop eating junk. Yes, junk food. Because your reproductive system thrives on real whole food. Food that you've seen growing in a garden or a field, or you've seen sold at the farmer's market that looks like it just came off the farm. You know, vegetables, fruits, whole grains, lean protein, plant-based fats like olive oil, coconut oil, avocados, nuts, seeds. best thing that you can do to build your fertility and be on a fertility diet is to eat real food. So start shopping at the farmers markets. I mean, sugar, especially high fructose corn syrup, sabotages ovulation. I'm going to talk more about sugar in tip number 3, but this is only tip number 2, and I'm talking about stop eating junk food, start eating real food. Things like trans fats and genetically modified foods, they are hormone disruptors. They interfere with our cellular membranes, and they just make things function not the way that Mother Nature intended. So that's why trans fats, genetically modified foods tend to be found in processed foods. So it's best to avoid those in general. Also, many people have trouble with gluten. Gluten is found in wheat, barley, and rye, and it can kind of gunk up the systems regardless of whether you're celiac or not celiac or gluten sensitive or not. Gluten in general just slows down healthy body processes, and many women can enhance their fertility by abstaining from gluten and going on a gluten-free diet. I'm a big fan of fruit, right? Because the fruit of our womb. So you want to eat fruit to produce fruit. Makes sense, right? And some of the best fruits for you if you want to boost your fertility come from berries. Blackberries, raspberries, strawberries, blueberries. I'm a big fan of the wild blueberries, not the cultivated blueberries. The wild blueberries have a lot more antioxidants in them. Generally, if you live on the West Coast, you're going to have to get them frozen because they mostly come from the eastern United States and eastern Canada and things like that. But they're the teeny tiny little blueberries that turn everything blue. Other fruits to consider are bananas, mangoes, melons, avocados, citrus fruits. I've found raw honey to be very hydrating and helpful, along with coconut water as well. So, tip number 2 is just stop eating junk. Let's start eating real food, right? So you want to eat fruit to produce fruit. Remember that one. All right. Tip number 3 is to balance your blood sugar. Blood sugar is really important for healthy ovarian function. So when you eat processed sugars such as high fructose corn syrup, white sugar, or even corn sugar, they cause a spike in our blood sugar. And then in order to balance the sugar in our blood, your pancreas releases insulin, and insulin opens the doors to your cells and shuttles that sugar in, and then the doors are shut, and insulin is the hormone of fat storage. So when you eat a little, half a cup of brown rice, your pancreas produces a small amount of insulin. But when you eat a stack of white flour pancakes and fake syrup, your body produces a lot of insulin, more than you need. And what happens is that this desensitizes your body over time to insulin. And this causes problems with your ovaries. Your ovaries don't like a whole lot of sugar. They don't like having a whole bunch of insulin in the body, and they tend to protect themselves by developing cysts. Ovarian cysts. This is one of the major issues in polycystic ovarian syndrome. Ovaries just don't like a lot of insulin. And so they wall themselves off and protect themselves, and then cysts form. So if you're consuming sugars day in and day out, your body is going to not respond to insulin as well, and in turn it's going to affect your fertility. So the goal is to diminish your insulin release and then stabilize it to help support your ovaries. And how you diminish the amount of insulin that's being over-released from your pancreas is to eat very well-balanced meals that are high protein, high healthy fat, like plant-based fats, with lots of vegetables, and then having some what I call resistant starches mixed in. And a resistant starch could be a bean, can be a squash, some potatoes, brown, black, or wild rice, or quinoa, right? So you can pair your high protein, high vegetable fat, and vegetable meal with some of the resistant squashes or resistant starches, somewhere between a half a cup to a cup once or twice a day. But foods that are especially good at helping balance your blood sugar are cucumbers, asparagus, spinach, artichokes, kale, garlic, butter leaf lettuce. The lettuce is eating a salad is always good because it's a lot of fiber. It helps stabilize blood sugar. Also, exercise is extremely valuable in helping with blood sugar balancing and stabilizing insulin. The more that you exercise, it reduces your insulin resistance and helps your cells respond to the insulin that is there in a better way. So your cells actually become more responsive to the insulin. Because again, it's the too much insulin, your cells stop responding, the ovaries stop responding. So how do we get them to respond again? We reduce the insulin amount, we start exercising, right? We balance the food. All right, so tip number 4 today is detoxification. Woo woo. I know it's, today's February 1st, but there were so many detoxification programs rolling around for January, New Year, body cleanse, clean yourself up, green juices, yada, yada. I've been seeing them all flying around, and it just all makes me so happy. But, detoxification is extremely important for fertility. I have a 3-week detoxification program that I do with my patients who are wanting to conceive. I mean, it's just like hands down, you want to conceive, you need to do a detox. And I literally have a list of over 100 women who have gotten pregnant after doing the detox. So this really speaks to the value of scrubbing out your system and cleaning it up and helping it to function optimally. Think of it this way. Your body is a filter, right? So what do filters do? Filters get clogged. And what do we need to do with filters? We change them. We get new ones. We swap them out. We hose them down, right? Well, it's not like you can get a new liver. So what are we going to do? We got to clean out the liver. We got to dredge it. We got to detoxify it. And this is why detoxification is so important for fertility. There are many, many reasons I could probably do a whole talk and maybe write a whole book on it, but I'm not going to. So here's what you need to know. When we don't eat well, we tend to consume more chemical compounds called xenoestrogens. And xenoestrogens are chemicals in our food. They're chemicals in our body products, what we put on our skin, our makeup, our hair, our nails. They're in our house cleaning products, what you're cleaning your counter with and you're scrubbing your floors with and all of those toxic things. And they bind to our hormonal receptors and they turn them on, they turn them off, they give them mixed messages, and it totally screws up our hormonal system. So when you detoxify, it helps your liver process those xenoestrogens better so that, it's like we take out the garbage and then your system is left, with good balanced blood sugar and healthy foods and all of this to give you the best chance at rebooting, literally, your reproductive system. So the 3 main organs that are involved in a detoxification would be your liver, your kidneys, and your colon. And a detoxification program cleans out your liver and your kidney filters, and it gets the waste moving much better through your colon. And by strengthening your toxic load, it improves the health of your reproductive system. But detoxification also has another important side benefit of reducing the toxin load that you pass on to your future fetus, okay? And many people don't think about this, right? But this is why it's so important. It takes 120 days for a healthy egg to form, and that's 4 months, and preconception planning and preconception nutrition and detoxification ahead of time, right? Because when you become pregnant, your blood supply goes to your fetus, and then, it's like an interchangeable maternal fetal blood supply. So whatever's inside of you, your fetus is going to get a taste of, okay? And so the most recent studies that have come out are showing that fetal cord blood measurements of upwards of 80,000 chemical compounds that are passed from mother to baby in utero. 80,000. And many of these chemical compounds are subject to developmental and learning disorders, right? So what you want to do is you want to clean out your filters and you want to scrub out your system, and you want to make sure that your garden for that egg to grow and that seed to be implanted is the cleanest, healthiest thing it can be, because you don't want to pass those things on to your future family member. Right? So detoxification, extremely, extremely important here. And number 5, de-stressify. That's right, ladies. You got to de-stressify your life. I got this word from David G. Maybe you know about him. He has a book on meditation called De-stressifying. But if you want to conceive, it's time to de-stressify. Because your body has two nervous systems. It's got the sympathetic nervous system, which is the fight or flight, and it's got the parasympathetic nervous system, which is the rest and digest nervous system, also called the feed and breed, right, which would be reproduction nervous system. So if you're tracking your ovulation and you're like, oh my gosh, I'm ovulating, and then you hunt down your spouse, you chase them around the house, and you demand sex, that might not be the nervous system that you're in. That might not be the feed and breed nervous system. You could be in the fight or flight. So how things happen in the reproductive world is very much in the parasympathetic nervous system. The two nervous systems balance each other out. We're fight or flight, and then we pause, and then we rest and digest, or feed and breed. So parasympathetic MO is in the flow. Life is good. Chillax. Everything is okay. You're dancing in the moonlight. It's a massage. It's how you feel after a yoga class, right? That's what parasympathetic mode is. And that's the mode you need to be in order to conceive and for the whole reproductive system to work its beautiful internal world of magic. So the fastest way to get yourself there, if you're like, uh-oh, I'm a stress case and I know that's not helping my reproductive efforts or my family planning, is by sitting down and taking a deep breath in through your nose and letting it out through your nose. And while you're letting it out, you can visualize white light going to your abdomen and pelvic area. And this simple breathing practice instantly helps metabolize your cortisol and get you in a place of parasympathetic nervous system. It gets you out of survival mode. So if you hang out in survival mode, more often than not, it is going to be more difficult for you to conceive, especially if there's a lot of stress from month to month about getting pregnant or when you're ovulating and you're putting all of that on yourself. Just remember, it's really not the best environment for conception. So depletion on many levels, whether it be nutrient, blood sugar, some of the birth, maybe you have got a history of birth control in your past, is the main contributing factor towards infertility. And when you are depleted in your mind, body, and spirit, it does become more difficult to conceive. And so I really hope that you've taken note of the 5 tips that I talked about today. If you need help with nutrition or balanced foods, I do have a cookbook. You can get it on Amazon. It's called Feed Your Cells. And my pregnancy book is coming out this spring, Over 35 and Pregnant, for when you do become pregnant. All right. Hope you have a great day, and I'll see you next Wednesday on Facebook Live. Bye for now.